Hello everyone, this is Bob Pye, and this is my um, Masters in Public Policy portfolio presentation. Um, Thank you for taking the time to view it. My work experience in public policy started, or most recently, is with the Commonwealth Medicine Unit of UMass Medical School. Commonwealth Medicine is a consulting unit nonprofit that's operated by UMass Medical School, and my team of project managers, of which there are five, are or I supervise five, are assigned to Mass Health full time. So as a senior project director, I supervise five other project managers, and I also have my own projects assigned to me. Typically, our projects durations are anywhere from 1 to 3 years, sometimes more, sometimes less, and sometimes we could have more than one project going at a time depending upon the size of the allocation. Some of the benefits to being a project manager working in Mass Health, the state Medicaid agency, is as a project manager and being reassigned to different units and different projects every couple of years, you actually get to see a better picture of the agency than some employees that work there all their lives. A lot of employees work in one unit and only see the agency from that viewpoint. As we move around from project to project, we get to see a 360-degree view of the agency, and we get to see how the different units interact with each other and how they make up the bigger picture of Mass Health, the agency. We also get to develop relationships across the agency which help in the operation of our project. When we're on a project and we need to when we need to complete a milestone that may impact another unit, it's helpful that we know many people across the agency as we go along our careers. Some of the areas that I've developed some skills and understanding as a result of the MPP program are in the arena of law, in both the administrative law class and environmental law classes. I've learned about the structure of government, the hierarchy of laws, and how laws and regulations, their relationship to each other. And it's helped me to understand the structure of Mass Health. Mass Health, as the state Medicaid agency, is actually a result of laws that were passed that are carried out by a federal agency, CMS, which is the Centers for Medicaid and Medicare Services. They develop the policies which states follow to run their own Medicaid programs. And then EHS, which is the Executive Office of Health and Human Services for the state of Massachusetts, they determine our own particular regs that they add that supplement the federal regs, and that's the foundation for Mass Health, and Mass Health is the agency that carries out those regs. Another important aspect of my MPP career has been in learning about policy research and including identifying policy changes, learning to ask the right questions, how to identify the best research framework, how to analyze the data and discover what the data is telling us about the policy challenge, and then using that information to develop policy that will have a positive impact on the issues. As far as economics, I've learned how economics impacts public policy and on many different levels. Using Mass Health as an example, Mass Health is the largest budget within the state of Massachusetts, and the decisions that are made on Mass Health not only affect the members, providers, and community organizations that work with Mass Health, but also impacts taxpayers and other constituencies. Many things that Mass Health does can have a big impact on the state budget. And when there's economic stress, Mass Health feels it very acutely. In the most recent Great Recession, when the Congress of the United States decided to cut some of their funding to states. That had an impact on us in staff cutbacks and budget cuts to services, which led to eliminating some services that we covered, such as dental benefits, for the extent of the recession. And current economic stress that our agency is under is trying to meet the current the current Governor Baker's goals for saving money and cutting the budget. One of the things that he did was pension buyouts, which has left us with somewhat of a brain drain, as a lot of people with a lot of experience and knowledge and leadership have left the organization, and there's a freeze on hiring, which impacts our ability to deliver services. I've also learned about public institutions and change management through my courses and the unique aspects that make up public management. One of the things that I've learned more about and built upon my project management experience is that change is constant, must be managed effectively, but it's also necessary to address policy problems. One thing that I think is unique to government about change is the amount of resistance. I think every organization experiences resistance to change, but I think in government we have our own unique resistance to change, and some of that's built into the structure of government, such as a two-party system that is constantly representing two sides of the coin and keeping each other honest. The three branches of government, which were set up as checks and balances to each other, and the bureaucracy itself, which can be huge and complicated and hard to turn, like a large tanker. One example of change and the difficulties of change is the Affordable Care Act. This act, the signature act of the Obama administration, was based on health reform in our own state of Massachusetts. And even though it was based on Massachusetts, when the Affordable Care Act was implemented, Massachusetts ended up being one of the worst states to effectively implement the new healthcare exchanges, which were used to manage the program. Why did it stumble? There are a couple ideas I have based on my experience there and from my what I've learned through the MPP, and that is that I think it's a lot easier in government to create than to replace. We had our own working system that was a model for the nation to use for their own new program. But when it came time to change that over, it was very difficult. We also had some unique problems in Massachusetts. We had three different agencies leading the effort without one clear person or agency taking leadership. And also the overburdened state workers, which I think for many members of the public may sound like an oxymoron, but I think when you take into account the recent recession, which forced us to cut resources and workers, and think that happened right around the time that we were implementing the Affordable Care Act. There's only, and even though the Obama administration accounted for funding for additional temporary hires, those temporary hires didn't have the experience and knowledge of a lot of the state workers that were either let go or were never replaced when workers let go, and leaving a small core of workers to not only work on the new exchange, but to keep everyday business going and to work on how to transition from the old system to the new. So I think it was a lot for an agency that had been pared down because of the recession. I think from my master's in public policy career and also my experience at Mass Health, what I've learned is some of the challenges that face public institutions that are unique to public institutions. We don't have stockholders, but we do have voters. So we do have a larger body that we respond to, but at the same time, we're not always as agile as private business. I think identifying problems is important, and I think what I've learned through public policy is that the way to address problems through policy is to collect data by setting up the appropriate survey or data collection tool, choosing the right framework to analyze that data, and then using that information to uh, to build off the research that has already been done in the literature, and then to come up with some policy solutions. And some of that, turning that policy into solutions, then becomes navigating the different parties and the different interests, and coming and building consensus for a program like the Affordable Care Act, and then once that happens, then dealing with the execution of the program. I think that I have built a skill set to make my to make me more capable of addressing some of the agency's problems um, in my role, and also in the future as I take on a leadership role to help identify and meet the agency's goals now and in the future. Thank you for watching.